By this time, you have a syringe full of your basic testosterone or a syringe full of testosterone and vitamin D3. Going forward, you're going to need to make a decision if you'd like to inject in the shoulder or in the glute. My favorite injection site is the glute. For the glute, we use a 1/2 inch 23 or 25 gauge syringe. Typically, it's a 23 gauge. For the shoulder, it's a 25 5/8 or 25 1/2 inch. To start, you're going to remove the 23 gauge head that you just used to draw from your 2 vials, or 1. At this point, you're going to make a decision of what syringe to use. In front of you, we have a 25 gauge 5/8 syringe. We have a 25 gauge 1 inch syringe, and we have a 23 gauge 1 inch syringe as well. Today you'll be seeing an injection in the glute, and the syringe that I use is a 23 gauge 1 inch. To remove the 21 gauge draw head, you're going to twist the head off, put it to the side, open up your 23 gauge, put it on, and twist the opposite direction that you just used to remove the 20 gauge. At this point, you're almost at the position to inject. There's a small reservoir that is between the needle head and the plunger of the syringe. That reservoir will be completely full of medication prior to injection.
The patient is now ready to inject the medication. The first thing you're going to do is take your alcohol prep pad and use it in a circular motion to disinfect the injection site. Next, you want to prime your needle to ensure that the medication is inside the needle tip and allow 1 to 2 drops of medication to drip to lubricate the needle head. Then you're going to go into the upper outer quadrant of your glute and prepare to inject.
After every injection, you're going to have a draw needle head as well as a syringe with a needle head on it. It's very important that these go in a safe place. Every single one of Core Medical's patients will receive a biohazard container, typically a lot smaller than this one, to place their syringes in and dispose of them properly. There are pickup places and drop-off places across the country that these can be brought to. On behalf of Core Medical, I'd like to thank you for taking the time to watch this video. Please understand that these videos are not a last resort. Our staff, patient coordinators, and physicians are here at all times to assist you with any of your goals, questions, or needs, especially when it comes time to inject your medication or if you have any questions on exactly how the medication works. Core Medical has locations all across the country. For additional information, please feel free to contact any location. And once again, we thank you so much for your time today.